BHOP stands for Behavioral Health Optimization Program, and it's a way to provide behavioral services as an integral part of medical treatment.
It embeds psychologists or social workers within our family health clinic to make those resources readily available to our patients.
We know that medical problems involve more than just the physiology and the science of the problem, but also social, emotional, and behavioral components.
We have to consider habits, behaviors, thoughts, emotions.
So we try to include all of that and provide the patient with a holistic approach to their care rather than just a primary medical model.
Because it allows them to have an extra set of skills and coping mechanisms for a lot of daily activities, stressors within their life, and allows them to stay a part of that PCMH family and not have to go outside and feel scared.
Our BHOP providers are also able to help us care for chronic diseases such as obesity, diabetes, tobacco use.
We have them for eating, we have them for sleep, we have them for PTSD.
They have specific skills that are helpful for behavioral modification and lifestyle change.
We're there to help because psychologists are experts in behavior change, and this is what we do. So having us there is providing state-of-the-art whole person healthcare, and I think that's what this is all about.
The Behavioral Health Optimization Program, or BHOP, is an integral part of providing holistic care for PCMH patients. Unfortunately, it's also one of the most underutilized services offered by PCMH. Every effort should be made to integrate BHOP with patients' primary care. Many patients who need behavioral health care avoid seeing a behavioral health provider for a number of reasons, including stigma, time, access, and cost. The integration of BHOP into PCMH attempts to remove these obstacles to treatment. Internal Behavioral Health Consultants, or IBHCs, are full-time BHOP providers in the PCMH clinic. As members of the PCMH team, IBHCs can work together with the patient and the PCMH team, and medical management staff members to develop a plan of care. Recommendations for the patient are documented in ALTA, rather than a separate mental health chart. This shared approach to care helps the patient to perceive their behavioral health care as part of their routine medical care, which eliminates the stigma often attached to receiving mental health care. All adult patients enrolled at the MTF are eligible for BHOP services, and IBHCs are available to see patients for scheduled 30-minute appointments as well as same-day open access appointments. Some MTFs also provide support for pediatric patients. You can check with your local IBHC to find out if pediatric service is available at your MTF. Time, access, and cost are no longer obstacles to care when IBHCs can offer this kind of availability within the PCMH clinic. Any member of the PCMH team, as well as medical management teams, can and should refer patients to BHOP whenever appropriate. Referrals can also come from enhanced access team members such as PharmD, dietary specialists, and physical therapists, as well as specialty clinics. The goal should be 50% same-day warm handoffs and 50% scheduled appointments. The appointment line is encouraged to book directly with the IBHC for certain issues, rather than booking with the PCM first, and should be trained to do so. IBHCs, or Internal Behavioral Health Consultants, are an integral part of the PCMH team. They are available to help the PCMH team and patients develop effective behavior change plans for a number of different health issues. Patients with mental health conditions should always be referred to the IBHC. These issues can include stress, anxiety, fears, or worry, depression, anger, relationship problems, and grief or bereavement. It's important to remember, however, that the IBHC is not just for mental health concerns. They can also help patients with clinical health problems, including insomnia, chronic pain such as headache, back pain, fibromyalgia, and myofascial pain, temporomandibular disorders, chronic disease management such as diabetes, GI problems, chronic obstructive pulmonary disease or COPD, hypertension, and dyslipidemia. treatment adherence, and lifestyle changes such as tobacco cessation, weight loss, diet, exercise, and moderation of alcohol use. IBHCs will also offer classes and groups to target common behavioral health concerns. They may partner with other members of the PCMH team, such as the disease manager or the nutritionist, to lead these classes. In some cases, the IBHC may need to triage patients to other appropriate mental health specialty services.
I refer patients to BHOP probably on a daily basis, and a lot of times I feel like patients are very optimistic with going.
Referrals to BHOP come from anybody on the team, and now they're actually starting to come from anybody in the clinic.
With warm handoffs is a huge part of our patient care, and PCMs bring their patients to our BHOP offices for visits.
I've always had great experiences when referring patients to BHOP. I've found that they've been available. If a patient needs to, they're usually able to see the patient same day.
Typically, if I think a patient has a need that day, my technician will go and walk down. They have their schedules posted as far as opening, so I'm able to get patients in that way.
We've had some great wingmen in our clinic where they have talked to somebody on their team, maybe in another department within the clinic, and said, hey, looks like you're maybe struggling, or you might want to talk to somebody. Have you thought about the BHOP?
And sometimes if a patient needs more care than what the BHOP provider is able to provide, they serve as a bridge to identify an appropriate provider to provide that additional care.
Because people sometimes maybe don't want to go that first step to mental health, so we try to be a segue that if they're having some concerns, stop in and talk to us first, and we'll help navigate them through the system to appropriate care.
I have a colleague, Dr. Nixon, who's part of our team that I'd like for you to see. He's the internal behavioral health consultant for the clinic, and I'd like to see if he has any suggestions on additional things we can do to help manage your diabetes.
Yeah. Okay.
I'll make the call.
Any member of the PCMH team can make a referral to the IBHC. The appointment line clerk can book IBHC appointments for patients with certain health concerns, such as sleep issues, weight loss, or smoking cessation. Nurses and techs can book IBHC appointments as well. Additionally, any team member can identify candidates for IBHC care during team huddles. Patients can also be referred by the medical management team or by their provider after a clinic visit. When you're introducing your patient to the IBHC service, it's important to communicate three main ideas. First, the IBHC is part of the primary care team. Second, the IBHC is there to help the two of you develop a plan or learn skills to improve health and functioning. And third, the IBHC may help you co-manage their care for a time, but the PCMH team is still in charge of the patient's care. Things to avoid saying to your patient include, I'm going to send you to mental health. We have a psychologist in the clinic I would like you to see. I would like you to see our behaviorist, and I'd like you to see our counselor. Remember, the goal is to make IBHC services available to the patient when and where they need them. Often, the best approach is a same-day warm handoff from the provider to the IBHC. The IBHC keeps slots open for this very purpose. Other patients will need to make a separate appointment for a later date. They can do this through the appointment line at their convenience or through a nurse or tech before leaving the clinic.
We know from research that patients get better quicker and stay better longer if they have a support service as an adjunct to their primary care medical service.
The behavioral health care facilitator is a psychiatric nurse, and they provide additional support for the primary care team.
This person serves as a case manager for some of our patients with difficult mental health care needs.
So if a PCM is prescribing a new antidepressant medication, a new anxiety medication, any type of psychiatric, psychotropic medication, that they would like a little extra help with monitoring that patient, they can refer the patient to the behavioral health care facilitator.
And she coordinates all of that care so that I'm not having to spend my time helping the patient find those resources.
They will actually call the patient and follow them via telehealth on a regular basis to check in, see how the patient's doing, measure their symptoms,
and help them live their lives and manage their lives in a way that facilitates greater health and improved quality of life.
If there are side effects, if there are concerns, they can report back directly with the PCM via TCONs and those types of things to ensure continuity of care, to ensure the patient is having someone that reaches out to them.
When we have a patient that we need to get connected with services in the community, she's a great resource for helping them find resources, therapist or psychiatrist in the community that she'll sometimes network for us.
So she's kind of like a go-between, and she's helped me numerous times with patients trying to get access to care that they need.
Hi, Mr. Nguyen. My name is Grace Rogers. I'm a nurse at your primary care clinic. Yes, I'm working with your PCM, Dr. Green. I was calling because we were wondering how you were doing on your new medication for depression.
Another integral member of the PCMH team is the Behavioral Healthcare Facilitator, or BHCF. The BHCF is a nurse with specialized training in mental health who collaborates with both the IBHC and PCM to coordinate behavioral health care and treatment adherence. The BHCF does not directly support the IBHC, but functions as a case manager primarily for adult patients who are prescribed medication by their PCM for mental health conditions such as depression, post-traumatic stress disorder, PTSD, or anxiety. The BHCF tracks, monitors, and assists patients to ensure adherence to pharmacological treatment, as well as behavior change plans. After the patient's first visit, the BHCF will directly contact the patient within 7 days, and again once a month until remission. In these telephone consults, or TCONs, the BHCF will check on several things, including medication compliance and side effects, adherence to PCM and IBHC treatment plans, symptom progress through screeners, and the need for an appointment with the PCM for medical management or the IBHC for skill training or problem solving. If time permits, the BHCF may also conduct psychoeducation classes on health concerns such as obesity or diabetes management. They may also assist PCMs with other psychiatric conditions, such as attention deficit hyperactivity disorder or ADHD, addictions, or severe mental illness.
I actually do think that BHOP is underutilized. I think that in some ways there's a misconception about what BHOP does. Sometimes we're thought of just as a smaller mental health clinic, which we are not. Sometimes we're actually thought of as they just help with depression or anxiety, and we really do so much more.
I don't know how much my job would actually get accomplished as far as what I recommend for patients without the BHOP providers.
They are absolutely necessary.
It's important that our providers utilize it so that we can maintain this service.